Good evening, everyone. Welcome to Dr. PK classes. Is my video and audio are clear? Is my voice is audible to everyone? Please let me know. ऑडियो वीडियो सब ठीक ठाक चल रहा है क्या? एक बार बता दीजिए. Yes. Clear? चलो फिर. Yeah. So in today's class, we are going to discuss the previous year questions of the drug inspector exam and the GPAT exam. Okay? About blood and body fluid related questions. ठीक है? अभी गुड नाइट है, गुड इवनिंग है, गुड इवनिंग, गुड इवनिंग ऑल. जाने से पहले हम गुड नाइट बोल देंगे, ठीक है? चलो शुरू करते हैं. तो फर्स्ट क्वेश्चन, दिस इज वेरी रिसेंट क्वेश्चन asked in the Uttarakhand DI 2024. A correct medical term for increase in RBC cells is called as. फटाफट आप लोग आंसर्स पोल में दीजिए. वॉइस धीरे आ रहा है क्या? क्या बोलते हैं? If the erythrocytes are increased, so we call it as polycythemia. ठीक है? So we call it as the polycythemia. If RBC are decreased, that we call as the anemia. If RBC are decreased, which means even the hemoglobin is also decreased because hemoglobin is present in RBC itself. ठीक है? Leukemia, there will be the more number of leukocytes, yeah, WBC cells. That we call as sometimes of blood cancer. Ischemia, if there is a red, if there is a less oxygen supply to a particular organ, so that we call as the ischemia. Okay, so the right answer is the polycythemia. आई एम यूजिंग द, ये पुराना माइक यूज कर रहा हूँ यार, वो जो मैंने बता रहा हूँ ना, नया माइक लिया है वो इसमें चार्जिंग नहीं हो रहा है. ठीक है? So this is abnormally high red blood cell count, which increases the blood viscosity, because blood may, in among all the blood elements, maximum number of cells will be the RBC only. So therefore the blood viscosity increases. Once the blood viscosity increases, it will slow the blood flow, which can lead to the risk of intravascular clotting. That is, the blood will clot within the blood vessels. That can lead to the ischemia, and finally it can cause the infarction or MI. If it occurs in the myocardium, it can lead to the MI. So disorder characterized by the above normal hematocrit value. So if the hematocrit value is more than 55% or more than 55 to 65%, we call it as the polycythemia. Hematocrit means it is the number of red cells present in the total blood volume. If we express the percentage, that we call as the hematocrit value. Otherwise, we call as a PVC, packed cell volume. ठीक है. जब वॉइस थोड़ा धीरे आवे ना, I will speak louder. Okay? Yeah. दूसरा क्वेश्चन है, ये यूपीएससी का दिए का एग्जाम है. एरिथ्रोपोइसिस इज द प्रोसेस ऑफ. इसका आंसर बताओ. एरिथ्रोपोइसिस का मतलब क्या होता है? सिंपल क्वेश्चन है, बेसिक क्वेश्चन. या सभी लोग सही उत्तर दे रहे हैं. सो एरिथ्रो का मतलब होता है रेड. पोइसिस मतलब मेकिंग और प्रोड्यूसिंग. सो making of RBC, development of the RBC, we call as the erythropoiesis. Generally, if all the formed elements are formed, that we call as the hemopoiesis or hematopoiesis. If all the cells are formed. So, if specifically we talk with respect to the RBC, then it is the erythropoiesis. The example is thrombocytes, thrombopoiesis. White blood cells, leukopoiesis. ठीक है. एरिथ्रो का मतलब होता है रेड. poiesis means to make a formation. So it is a process by which RBC are formed from the hematopoietic stem cells in the bone marrow, because after the birth all the blood elements are formed only in the bone marrow. Before birth there are other sites, okay, like spleen, liver, but after birth this is the only site where all the blood elements can be synthesized. ठीक है. नमस्ते नमस्ते. ये भी यूपीएससी का डीए का क्वेश्चन है. which of the following statement regarding the blood group O is correct? Yeah, yolk sac, thymus, spleen. फटाफट बताओ इसका आंसर. D. Yes, everyone saying the right. Yeah. So which of the following statement regarding blood O is correct? So if it has agglutinogen matlab antigens, because the ABO blood group system is based on the presence or absence of the antigens. otherwise called as the agglutinogens. So if agglutinogen A is present, that we call as the A blood group. अगर B होगा ना, उसको हम B blood group कहते हैं. If it has got both A and B agglutinogens, then the person is said to have AB blood group. ठीक है. If the person has neither A nor B antigens, then we call as the O. But the option is given in the terms of antibodies, agglutinins. So the O blood group person will contain the agglutinin anti-A as well as anti-B in the plasma. So this is the correct one because it doesn't contain any antigens. So therefore it contains both the antibodies, anti-A as well as anti-B. Okay. Yeah. So this is a summary of ABO blood group. So this is A. If antigen A is there, call as A. B antigen is there, call as a B blood group. Both AB blood group, neither A nor B, O blood group. Agglutinins for A blood group it contains anti-B. For B anti-A. For AB it doesn't contain neither anti-A nor anti-B. For O both anti-A and anti-B. So this is the right answer given in the options. Okay. So even we call so O blood group can be given to anyone. You can see here. So therefore it is called as the universal donor. O blood group is considered as the universal donor, whereas AB is called as the universal recipient. Yeah. Yeah. ये भी recent DI का question है. The total amount of water present in the body cavity in a 70 kg adult male is. तो क्वेश्चन को केयरफुल रीड करना पड़ेगा. ये क्या पूछ रहा है इस क्वेश्चन में? टोटल अमाउंट ऑफ वाटर प्रेजेंट इन द बॉडी कैविटीज. बॉडी कैविटीज में वाटर का परसेंटेज या वाटर कितना होगा. ठीक है. ओनली इन द बॉडी कैविटीज. देखते हैं इसका आंसर कितना लोग सही देते हैं. बी सी. नहीं सी होगा. सी तो नहीं होगा. ये तो पता चल रहा है. सभी लोग आंसर तो गलत दे रहे हैं. So the right answer is the total amount of water present in body cavities. Body cavities means, for example, pericardial fluid, the fluid which is present in the joints, or the fluid which is present in the eyes, the fluid which is present in the CSF. उसी को हम body cavities में fluid कहते हैं. So that is around 1 to 2 liters only. Very little amount of water is present in the body cavities. ठीक है, या उसी को हम ट्रांस सेल्यूलर फ्लूइड कहते हैं. So the extracellular fluid is divided into generally interstitial fluid and plasma. Generally the ECF. ECF में हम interstitial fluid को include करते हैं और plasma को include करते हैं. And this ECF is approximately 40 liters होते हैं. ठीक है? But apart from interstitial fluid, plasma fluid, there is a very smaller compartment is also there, that is called as the transcellular fluid. तो इसमें क्या क्या होगा? The fluid in the synovial, peritoneal, pericardial, intraocular, as well as the CSF, cerebrospinal fluid, which is a type of extracellular fluid only. So if you see the fluid which is present in all this transcellular fluid, which will be around 1 to 2 liters होता है. ठीक है? In a 70 kg adult man body water, the TBW, total body water, will be equal to 42 liters. Yeah. So in 42 liters, the 28 liters will be present in the within the cells that we call as the ICF, intracellular fluid. The remaining 14 liters will be extracellular fluid. Extracellular fluid. So when you compare the extracellular intracellular, सेल में अंदर ही ज्यादा वाटर होते हैं. ठीक है? The answer is transcellular fluid, which is around 1 to 2 liters. ठीक है? This was there in the Guyton book, the standard book Guyton. ठीक है? या ये तेलंगाना DI 2023 का क्वेश्चन है. Under some circumstances, hemoglobin releases nitric oxide NO. तो NO का काम क्या होगा? मेन फंक्शन ऑफ NO. ये तो हम फार्माकोलॉजी में अक्सर पढ़ते हैं, वो इंपॉर्टेंट है. एंड समटाइम्स इट इज अ न्यूरोट्रांसमीटर आल्सो, NO और न्यूरोमॉड्यूलेटर. Yeah. So everybody is saying the right answer. So the nitric oxide, the main function of nitric oxide is vasodilator. And in fact, many drugs which are acting as a vasodilators will act through by releasing the nitric oxide. Okay. So in addition to its key role in transporting oxygen, carbon dioxide, hemoglobin also play an important role in the blood flow and blood pressure. How they regulate the blood flow and blood pressure? By releasing the nitric oxide. So this nitric oxide causes the vasodilation. So when there is a vasodilation of the blood vessels, it will increase the blood vessel diameter that occurs in the smooth muscles in the vessel wall relaxes. So this vasodilation will improve the blood flow. Once the blood flow is increased, automatically the oxygen carrying capacity of RBC also increases. ठीक है? सेम ये भी टीजीडीआई का एक डीआई का क्वेश्चन है. व्हाट इज द ब्लड वॉल्यूम इन एवरेज साइज्ड अडल्ट मेल? सो अडल्ट मेल में ब्लड वॉल्यूम अप्रोक्सीमेटली कितना होगा? Yeah. So it is 5 to 6 liters in the male. In the females, it is 4 to 5 liters. The blood volume is 5 to 6 liters in the adult male, whereas 4 to 5 liters in the average sized adult female. So this difference, the gender difference, is mainly due to the difference in the body size. Okay. Yeah. So this, what does the low count of monocytes indicate? The low count of monocytes indicate. यहाँ पे 3 स्टेटमेंट्स दिया गया है. पहला है बोन मैरो सप्रेशन, दूसरा ट्रीटमेंट विथ कॉर्टिजोल और तीसरा वायरल और फंगल इन्फेक्शन. तो इसमें से क्या क्या सही है? कौन सी स्टेटमेंट सही है? फटाफट जवाब दे दो. You are saying A, C, even D. I will see. So, as I told you, all the blood components are synthesized in the are produced in the bone marrow. So, when the bone marrow itself gets suppressed, obviously the number of cells, the number of WBC cells like monocytes can be decreased. ये तो सही है. Even the treatment with cortisol also decreases the number of monocytes. This is also true. Viral or fungal infections. Generally, whenever there is infection, the WBC levels will be increased. Why? Because in order to fight against the pathogens, in order to against fight invading microbes, the WBC levels will be increased. ये डिक्रीज नहीं होता है, ये इंक्रीज होगा. ठीक है, मतलब जो थर्ड स्टेटमेंट है वो गलत है. ओनली 1 and 2 आर राइट, ठीक है। ठीक है, चलो, yeah. So this is the significance of high and low count of various WBC cells. So if you say the neutrophils, you take any neutrophils, you take any WBC cells, most of them will be increased in the presence of pathogens, in the presence of infection, whether it's a bacterial, burns, or stress, inflammation. So कम डिक्रीज होता है रेडिएशन एक्सपोजर, ड्रग टॉक्सिसिटी, विटामिन B12 deficiency, and SLS, systemic lupus erythematosus. Lymphocytes, same infections and some leukemias. Then when the low count will be there, HIV infection, immunosuppression, or treatment with the cortisol. The question has is the monocytes, viral or fungal infections, even the TB and some leukemias. The number is increased, but the number is decreased in the bone marrow suppression and treatment with cortisol. Likewise, eosinophils, because eosinophils and basophils are mostly involved in the allergic reactions. So whenever there is an allergy, immediately these two types of cells will be increased. Detox stress में decrease होता है, eosinophils and basophils pregnancy, ovulation, stress conditions में decrease होगा. This is about the differential count of the WBC cells. Under what conditions they increase and what conditions they decrease. ठीक है, then which of the following options are correctly arranges the blood plasma proteins in decreasing order of their abundance? मतलब सबसे ज्यादा कौन सी प्लाज्मा प्रोटीन होता है, उसके बाद कौन सी प्लाज्मा प्रोटीन ज्यादा होगा. So you have to arrange in the decreasing order or descending order. Yeah, most of you are giving the right answer. So the mostly albumins followed by globulins and followed by the fibrinogen. Yeah. The plasma proteins are mainly synthesized by the hepatocytes, and which include the albumins around 54%, globulins around 38%, and fibrinogen around 70%. So albumins followed by globulins, then fibrinogen. Next one, which hormone stimulates the RBC production? रेड ब्लड सेल प्रोडक्शन, ये तो हमने क्लास में भी डिस्कस कर चुके हैं। Explain it again. Question number 8. Yeah, what type of proteins are present in maximum number? ठीक है. So here the RBC production is stimulated by the erythropoietin. Erythropoietin. If you see the process of hemopiesis, so during the hemopiesis, uh, the myeloid stem cells that can be differentiated into the CFUs, colony forming units, CFUs. Like you have the CFUE, CFU-MEG, CFU-GM. So the CFUE, which indicates ultimately that produce the RBC or erythrocytes. The MEG will produce the megakaryocytes, nothing but the platelets. Then GM ultimately produce the G means granulocytes, M means monocytes. In the next generation, these cells we call as the precursor cells, are also called as the blast cells. Blast means immature cells. Blast को immature cells को हम blast cells कहते हैं. For example, monoblast will develop into the monocytes. Eosinophilic myoblast will develop into the eosinophils, and likewise. So various hormones that we call as the hemopietic growth factors, the growth factors that will regulate the differentiation and proliferation of these cells. For example, if you see the erythropoietin that increase the number of RBC precursors. Okay. Likewise, even you have the thrombopoietin that will increase the precursors for thrombocytes. Heme is, these are the previous GPAT questions. Heme is, yeah. So it is an iron containing tetrapyrrole or pyrrole. Iron containing tetrapyrrole ring system will be there. So hemoglobin is the iron containing coloring matter of RBC. The red color is mainly due to the pigment. That pigment we call as the hemoglobin. And the average content is in adult female it's at 15 grams per deciliter. Female is the 14.5 grams per deciliter. So if you see the chemically, which is a hemoglobin is a conjugated protein. So it consists of the two parts. One is heme part, the other is the non-heme part. So it consists of a protein combined with the iron containing pigment. The protein part is called as the globin. Then non-protein part we call as the pigment, that is the heme. And in the heme, the iron will be present, and mostly the iron exists in the form of ferrous state, not the ferric state, Fu2 plus ferrous state. And if you see the structure of the heme, the pigment that is present in the heme is called as a porphyrin, and which is formed by the four pyrrole rings. Four means the tetrapyrrole rings. Okay. You know the pyrrole structure? There will be more pyrroles will be there, and all these are joined to the ferrous iron. So that we call as the tetrapyrrole ring system or porphyrin. In the place of iron, if it is a magnesium is there, we call that as the chlorophyll. Okay. अगली बार मैं नया माइक फिर से ले लूंगा, ठीक है, तब आवाज ठीक आ जाएगा. Yeah. Several different chemicals released by the microbes and inflamed tissue attack the phagocytes. So this phenomenon is called as, this chemicals released by the microbes or inflamed tissues attract the phagocytes. This is we call as the chemotaxis. As I told you, chemo means chemicals, like we say chemotherapy. So we are treating the infections by using the chemicals. Axis means movement. So movement towards the chemicals which are released by the microbes or inflamed tissues. That is called as a chemotaxis. Okay. And this is the important property of the WBC, because most of the WBC, especially the neutrophils, they are travel to the site of infection. जब भी कोई infection होगा ना, so that the WBC are travel towards the site of infection. And in fact, this is one of the property of WBC. So you have the diapedesis process by which the leukocytes will be squeezed through the narrow blood vessels. Then it also shows the amoeboid movement by protrusion of the cytoplasm. They can change the shape. The third is the chemotaxis. So attraction of the WBC towards the injured tissues by the chemical substances released at the site of injury. So this is the one of the property of WBC. Okay. Okay. Yeah. Same question, but it is asked in a different way. What is chemotaxis? Sometimes the questions can be repeated in the competitive exams. Same question. Again, taxis means movement of leukocytes towards the chemicals which are released during the inflammatory process. So that we call as the chemotaxis. Okay? That is the first, whenever you study, you have to understand the meaning of the word. Because most of the times the answer will lie in the word itself. We will get some clues through the question itself. So once you get clarity on the sentence or the words that are given, then automatically you'll be able to give the answers correct. Same thing here. There is a chemotaxis, attraction of the WBC towards the injured tissues. Identify the clotting factors, which is known as stored factor or thrombokinase. Many times the questions will be asked on the simply the name of the clotting factors. You take any exam, whether it is a DI, GATE, NIPER, pharmacist, whatever. Yeah. Factor 10 is called as the Prower-Stout factor. Factor 4 is calcium itself. Factor 8 is, what is the name of the factor 8? PTC, plasma thromboplastin antecedent, anti-hemophilic factor A. Then factor 12 is contact factor. So one is fibrinogen, two is prothrombin, three is thromboplastin, a tissue factor, four is calcium, fifth one is labile or proaccelerin, seventh one stable or proconvertin, eighth anti-hemophilic factor A, or it is also called as the PTC, plasma thromboplastin antecedent. The ninth Christmas factor, plasma thromboplastin component or anti-hemophilic factor B. 10th one, stored power factor or thrombokinase. 11th, plasma thromboplast antecedent or anti-hemophilic factor C. 12th, Hegeman factor or contact factor. 13th is the fibrin stabilizing factor. I think it is not visible here. The 13th one is fibrin stabilizing factor. You can see here. Okay. Then blood grouping is basically possible because of the presence of. Already we have discussed the same thing here. blood group is basically possible because the presence or absence of antigens. ये antigens पे कहाँ पे होते हैं? That are present on the plasma membrane of RBC. जो प्लाज्मा मेम्ब्रेन के ऊपर आरबीसी के ऊपर जो एंटीजेंस होगा उसी के ऊपर ब्लड ग्रुपिंग डिपेंड होता है. ठीक है. The surface of erythrocytes contains the genetically determined antigens we call as the agglutinogens. Antigens or agglutinogens based on the presence or absence of various antigens. Blood is carries different blood groups. So generally we follow the ABO blood group. The persons who display or who display only antigen A that have the type A blood group. Those having only antigen B, they are of type B. Those having both antigen A and antigen B, they have type AB. Neither antigen A nor antigen B, they are considered as the type O. This is even in the presence of RH factor. There is one more antigen is there that we call the RH factor. If that RH factor is present, that antigen is present, we call as the positive. If that antigen is absent, we call as the negative. So likewise, A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, O negative. So that is based on the RH factor. Okay. All right. Because why it is called as RH? Because it was first isolated in the monkey. The name of the monkey is rhesus. इसलिए हम इसको पहले दो लेटर पर लेके हम ऑरेंज नाम दिया गया है. ठीक है. A most common type of megaloblastic anemia caused by the malabsorption of vitamin B and characterized by the decreased production of HCl in the stomach and a deficiency of intrinsic factor is called as. क्वेश्चन तो लंबा है मगर सिंपल है. So, most common type of megaloblastic anemia, which is caused by the malabsorption of vitamin B12, and here's deficiency of intrinsic factor that we call as the pernicious anemia. So, intrinsic factor is essential for the absorption of vitamin B12 from the terminal ileum. Some persons doesn't have the intrinsic factor, so there is no absorption of vitamin B12 that can lead to a megaloblastic anemia that we call as the pernicious anemia. Okay. Yeah. So anemia can be classified based on the two factors. One is based on the morphology, we call as the morphological classification. The second way of classification is based on the etiology, based on the cause of the anemia. So if you see the etiological classification, that is a hemorrhagic anemia. Hemorrhagic means excessive loss of blood. So the anemia occurs due to the excessive loss of blood that we call as hemorrhagic. Hemolytic, lytic means lysis of RBC. So if there is a more amount of destruction of RBC, that can lead to anemia, that we call the hemolytic nutritional deficiency anemia, that is due to the deficiency of the various nutrients like iron deficiency anemia or pernicious anemia, which is due to the deficiency of vitamin B12, megaloblastic anemia due to the deficiency of folic acid. Generally, vitamin B12 and folic acid together can cause the megaloblastic anemia. Aplastic anemia, this is due to the disorder of the red bone marrow. जब भी रेड बोन मैरो डिसऑर्डर होता है ना, पूरा का पूरा ब्लड एलिमेंट्स कम होता है, उसी को हम एप्लास्टिक एनीमिया कहते हैं। ठीक है, so this is the etiological classification. The other one will be the morphological classification, like normocytic, normochromic, hypochromic, hypocytic. So based on the size and the color of the RBC cells. ठीक है, yeah. So those who are not yet joined in our classes, you can join. So we have the Brahmastra 2026 for the fourth years, Brahmastra 2027 for the third years, 2028 for second years, and 2029 for the first years. So those really want to crack the exam, any sort of exam, competitive exams in the field of pharmacy, you can enroll as per your convenience in any batches. Again, this is the droppers batch. And this is the meet our best team, Dr. VK classes. This is about today's class. Thank you. Anything you want to ask, you can ask. और किसका कुछ पूछना है तो पूछ लीजिए. Good night all. If no questions, then we'll end करते हैं. ठीक है? So I will meet you in the next class. As you know that we are completely giving the classes at free of cost. So those doesn't afford the money, you can join in our free classes. So that is going to start from the Monday. Monday से onwards हमारा free classes शुरू होने वाला है. So those who are not yet registered, please do register. Thank you.